See, she's got her neck in line with the top of her spine, and then she's got her belly in line, and then she's got this under her knees to keep everything in a straight line, even all the way down to the ankles. Are you pregnant and struggling to get a good night's sleep? Well, there's a few simple things you can do to change that. And on this video, I'm not just going to tell you what they are. I've got my sister-in-law who's 40 weeks pregnant and a midwife, so we're going to get in bed and show you what you can do tonight. These same tips can help you with back pain, digestion, anxiety, and so much more. So why is pregnancy and sleep so difficult? Well, growing a human is no joke. Neither is trying to get 8 hours of sleep while doing it. You've got hormonal shifts, that growing belly, heartburn, and those delightful 2 a.m. baby karate kicks. Sleep during pregnancy is a whole different game. So I've brought in someone very qualified to help, my sister-in-law, Gabby. She's a midwife, she's pregnant, and she's going to show you exactly how she's finally sleeping comfortably through the night, after years of coaching other women to do the same. The number one position recommended during pregnancy is sleeping on your side. Why? Because it improves blood flow to your placenta and the kidneys, reducing swelling and increasing oxygen to your baby. Preferably it should be a left side, but most recent research said that the right side is just as comfortable as long as you're not sleeping on your back. I'll tell you why in a minute. But it's not just which side you sleep on, it's how you support your body that really matters. You have to make sure that your hips are in line. Misaligned hips equals misaligned spine equals pain. And here's what happens when your hips aren't supported. Your spine twists, causing back pain, hip soreness, and sciatica pain. You've got this big nerve running down the middle of your butt cheek. That's your sciatica pain. If you've had that before, you know exactly what I'm talking about. But not only that, blood flow drops as the baby puts pressure on the inferior vena cava and the pelvic veins, which can slow circulation. And this is a problem because that decreases the amount of oxygen that your baby's getting. You also get a strain on your ligaments due to the hormone relaxing. Your joints become more flexible and less stable. Being in the wrong position also puts pressure on your SA joints where your spine meets your pelvis. It also puts extra pressure on your hips, your knees, your lower back. So let's go to Gabby's house and take a look at what she's doing to get the best night's sleep. So I brought somebody very qualified to help, my sister-in-law Gabby, and she's also a midwife and 40 weeks pregnant. So exciting. And she's going to share with you her sleeping positions and how she's finally been able to get comfortable through the night and have a good night's sleep. Right, Auntie Gabby?
Yes.
And she's going to show you exactly how she's sleeping now using her pillows and how she's finally got the most comfortable position to sleep all through the night. And some tips and tricks that she shares with her patients when she's in the hospital, because she's a very experienced midwife. So it's amazing that we've got her on this video and that she's pregnant. Perfect. Okay, so the number one position recommended during pregnancy is sleeping on your left side. You can also sleep on your right side, you know, if that's more comfortable for you. The point is here to get a good night's sleep. But we're going to show you the recommended position, which is sleeping on the left side. So the reason why you sleep on your side, your left or your right, is just to improve and keep the blood flow to the baby. And this is to prevent stillbirth. Gabby was telling me new research, left or right side is the best, whatever you can manage. And this is to keep the blood flow to your baby. All right, so Gabby's going to show us exactly the way that she sleeps every night. All right, so as you can see here, she's got this big thick pillow in between. I'm just going to take that out so they can see. So it's not too poofy, but the point of this being between the knees and the ankles is to keep her hips aligned. And the reason that this is important, if you have misaligned hips, then you have a misaligned spine, and this can all add up and create more pain during the night and when you wake up in the morning. This might be the reason why you're feeling so sore when you get up. So if your hips are misaligned, then your spine could not be aligned. And this can cause pain, this can cause sciatica, which is not ideal when you're growing a baby and you're getting this bump growing bigger. And the next pillow that Gabby has is a little one under her bump. So I'm just going to take this one out. She has like a double one. So she's got this one under the bump and she's got, this is how thick it is. And she's got this one behind her back. So this one behind the back is going to stop her from rolling over, which we'll talk about in a minute why that's important. And we've got this one underneath the bump, which will show you. So if this wasn't here, her bumps dropping down to the side, which is creating more pressure. So it's just really comfortable to have that underneath, and it's not too thick. And this one under the belly as well, it just slightly takes the pressure off your back. If you imagine that this isn't here and the weight is pulling your belly forward, so this is just taking a little bit of pressure off the lower back here. And then she's got this V-shaped pillow here, and this she's got a little arm underneath it, and that's just a support and everything, and it's just keeping her spine in that perfect alignment. See, she's got her neck in line with the top of her spine, and then she's got her belly in line, and then she's got this under her knees to keep everything in a straight line, even all the way down to the ankles, and this just keeping everything nice and neat, and just really adds to that comfort level. And promoting healthy blood flow for the baby is very important. This, moving on to the next point of why we have this pillow behind the back. It's okay if you wake up and you're lying on your back in the middle of the night, right, Gabby? It's not something that you need to panic about and think that you've damaged your baby. It's completely fine. This is why we recommend just having a little pillow at the back to prevent you from rolling. But if you don't have that and you roll on your back, don't worry if you wake up and you're on your back. It's absolutely fine. Just roll over onto your side again. This is why we recommend getting in this position, the earlier the better, so that you can get used to lying on your side. If when you weren't pregnant, you are a back sleeper, get used to lying on your side. The reason for this, if you lie on your back, you have this huge weight, and this is putting pressure on a vein called the inferior vena cava. If you have pressure on this large vein, this is just going to stop the blood flow to your baby. That's the point of not lying on your back. You don't want to be there for a long period of time, and your body will, if you lie in there for a long period of time, your body will automatically wake you up because you're reducing the blood flow. But that's the point of this, not to lie on your back. Just have that little pillow around the back, around the small of your back, to prevent you from doing that. This is not Gabby's pajamas. She's just got her sportswear for the point of this video to show you guys how she sleeps. But we're going to talk about that in a second, what you actually do wear to make sure that you stay asleep once you have fallen asleep in this beautiful, comfortable position. So Gabby is going to just roll into a... Oh, this is actually so mobile for 40 weeks. Much more mobile than I was. She's just going to roll onto her other side just to show you what it would look like. If you don't have the pillow that's connected underneath, it's okay. You can just use a little small one. This pillow actually comes with an extra little insert just to have handy, like if you feel like you need an extra wedge here, or you need an extra wedge underneath your bump or underneath your arm. Just take a notice of if you're lying in a straight line. So yeah, as you can see from the back, she's got her knees bent, and then she's got her ankle supported, and you can see this visual line. It's really, really straight. Nothing's twisted too high or too low. All right, now that your body's supported, let's talk about actually falling asleep. Number one, you need to be cool. Wear light cotton or even sleep semi-naked. Let's be honest, pregnancy brings night sweats, leaky boobs. Your body needs airflow to regulate your temperature. Tip number 2, try the 4-7-8 method. You inhale for 4 seconds, hold for 7, and exhale for 8 seconds. This calms your nervous system and triggers the brain to switch you into sleep mode. Now, there are lots of mistakes that new moms make. I made all of these mistakes. But before I tell you those, I just want to mention another 2 tips that are really, really helpful to help you fall asleep fast. Tip number 3, try some smart bedtime snacks like bananas, almonds, oats. These are higher magnesium and tryptophan to help boost natural melatonin. Tip number 4, make your room into a sleep cave. Cool, dark, quiet, no blue light. Your melatonin needs total darkness to work. So these mistakes I mentioned about, I want to tell you about them. I made all of these mistakes, and thankfully I learned, so I didn't do it with my second and third baby, which was sleeping flat on your back. This is a no-no for you and the baby. The pressure and the weight of the baby, if you're lying on your back, it's so uncomfortable. But not only that, you have a huge artery in there, and this is called the inferior vena cava. So if you lie on your back, you put pressure on this, and this stops circulation going to your heart, which then stops circulation going to your baby. So then your baby is not getting the oxygen that it needs. So don't do that. If you do it just for a second in the middle of the night, don't worry, but try not to. So Don't lie on your back. That is the first mistake I made. The second one is drinking too much water before bed. This makes you go up and down, and just try not to do it. Try not to hydrate yourself just before bed. Instead, take little sips during the day. The next mistake is skipping naps. You have so many things to do, all the lists that you need to do to take care before the baby arrives. Just relax. You need your naps during the day so you don't crash too hard at night and you're not too restless. And the last mistake is too many or the wrong kind of pillows. Look at what Gabby's used and try and aim for these types of pillows and position them perfectly so you get a good night's sleep. If this video helped, let me know in the comments. If you want more tips for deep natural sleep, I've linked my free sleep guide PDF below. It's packed with positions, foods, breathing tools to help you fall asleep faster and stay asleep all through the night. If you want a meditation video to watch next, now that you're in the perfect position, watch this one where I teach you how to do the 4-7-8 breathing method. It's really relaxing. Watch this one next.